Welcome back, everyone. Have you ever thought about enhancing your natural beauty or maybe reversing the signs of aging, but you're not really sure where to start?
Well, joining us now with some answers is facial plastic surgeon Dr. Haresh Yalamanchili from the Belage Center. And yes, I said your name right.
It's great. It took me to about second grade, so well done.
So tell me about the Belage Center.
So the Belage Center is a practice that I founded in 2009 when I moved from New York to Houston, and I'm a facial plastic surgeon, so I specialize in everything above the shoulders. And I really kind of created it with the intention of offering a comprehensive treatment options from anything that you can think of that can help enhance cosmetically the face, the neck, the hair.
I think what's unusual about your practice, though, is you're sort of a one-stop shop, because even if someone is not maybe ready to do a full surgery, like a surgical facelift, you also do fillers, you do hair transplants, you sort of do everything from the neck up.
Right. I mean, so when you think of specialist, I mean, it sounds very narrow, but the face, as you said, has a lot of things that we can actually do there. And about 17 years ago when I started, there was only a facelift or an eyelid lift or a nose job. And in that period of time, there's so many non-surgical options that have come up. You've heard of Botox, fillers, lasers, which is great because we can now kind of cover a lot of ground, and a lot of people who might have never thought about surgery or too young or didn't really need it, we have a lot of other options. Now, it's good, but the problem is there's so many options, sometimes it gets really overwhelming.
Yeah.
Where do you start? Is Botox the same as fillers? If I get Botox and fillers, that means I don't need to have surgery, and that's not necessarily true. So that was kind of the point of what we try to create, and the mission really we have at the Belage Center is to educate our patients so that you can make your own choices and you realize you can kind of separate the hype from what really works and figure out what makes sense for you.
So let's kind of run through a few of the things that you do. Let's start with the InstaLift. Tell me about it. What is it?
So that's just it's a relatively new non-surgical option. I kind of threw that in there just to kind of bring up something that's really only been out here about a year and a half in the States. It's been in Europe for a little bit longer. And really all it is, it takes about 30 minutes and you get a little lift. I mean, you're able to kind of deliver these little specially designed sutures, believe it or not. This is, you come in wide awake, you numb everything up. It's not a lot of bruising. That's her about a week later. And it's something that just gives, like I call it a two-finger lift. So whatever you can do with two fingers,
Two-finger
within reason.
lift.
I know some women can do a lot with two fingers, but
you realize that everybody's sitting at home going like this right now.
So that's really where I think its sweet spot is.
And do you sometimes have people who come in thinking they might want a facelift, but then it turns out they don't go through a surgery anyway because you're able to help them in some other way?
I mean, more people probably come and think, I'm never going to have a facelift because they're scared of it, and they think of these disaster stories or people who look overdone and all that.
Well, yeah, I mean, that's
the trick, right?
That because sometimes, you know, we've all seen men and women with an overdone
too much,
face.
yeah.
But one of your, I mean, like, hearts and souls of your business is the natural look.
You hit it on the head, absolutely. And I think the secret, it's not much of a secret of doing that is, number one, realizing that all these tools that we talked about, whether it's surgery or non-surgical options, I think you need to be really good at all of them. And you need to be able to offer as many of them as you can, because when you do that, then you have a full set of tools that you can use as opposed to having just a hammer and everything becomes a nail, right?
So we just saw a picture of the comprehensive rejuvenation. We're now looking at a facelift.
It's such a dramatic
change. I mean, this is a great example of someone who had more laxity than that InstaLift picture, for example. And when you look at her, you can see that she has more laxity in the neck and the jowls under the in the mid-face area. But to be honest, even though she underwent like a facelift and a neck lift, if you took away the before picture and you look at the after, you just think she had great genes.
Yeah.
Right? I mean, it looks natural, I think, and she certainly did. And I think that's the key.
You're going for more like the 5-10 years younger versus the going for the 20 years younger.
Yeah, I mean, to be honest, everyone always asks how much younger am I going to look, and I really don't. I mean, I'm not, and it's a fair question, but that's not how I look at it. And I don't think that's the right question, is how much younger. It's not about, are you going to look like you did 15 years ago?
Yeah.
Truly, that's not possible. Are you going to look great and look, as good as you can, whatever age you are? Absolutely, and that's our goal.
Right? Ear pinning is another procedure that you perform, and describe this, because this is fascinating to me.
Yeah, so otoplasty is what we call it in the medical literature, but really what it is if you think about your ear, the ear is folded, and it's kind of pretty complicated how it's folded up, and some people, it's not folded as much, and so you end up having all that cartilage is still there, but it's not folded right, so it sticks out further from your skull. And so when that happens, it looks pretty obvious, and I mean, people can catch it. And so, usually you see a lot of young adults or children, but actually there are a lot of women I treat, and men for that matter, but really more women who get to that point where they've always had to wear their hair long. because their ears stick out. And so they can't put their hair up, and they'd like to, and they're just very self-conscious about it. So we actually treat a lot of older women as well.
It's so great that there's even an option for
One of
that.
my favorite
Okay, what
procedures.
about the ear gauges? See, a lot of people are doing the ear gauges nowadays.
Right. Yeah, that sort of became I didn't expect it to become something I do a lot of, but it turns out I do a fair amount of that. And really what happens is, over time when you have these gauges that you put and they get larger and larger, I guess there's a point sometimes when people don't want to wear them anymore. And unfortunately, the earlobe doesn't
Close back
up again. And you can end up with quite a large hole in the earlobe. And so you actually have to do a little bit of an earlobe reconstruction and recreate the earlobe. And it's usually people who are going to the workforce where it's probably not as common to see that. The military, certainly, things of that nature. So I do a fair amount of that as well.
Well, because I'm sure a lot of teenagers gauge their ears, and they have these loose, floppy earlobes, and then, like you said, they try to join the service, they try to get a job, and it's...
Correct.
Okay, what about hair transplants? I know that's a big business.
Hair transplants are fun. Actually, what's interesting is hair, when people think about hair transplants, they're still thinking, most people, the public perception is what it looked like 20 years ago. Plugs, looks unnatural, looks fake. And the reality is, especially at this day and age, we have technology that is just astounding. So basically, you're able to remove hair from the back of your scalp.
That is so cool.
You take them out one by one, like taking pixels out of a TV. So if you do it right, you can't tell you took them out from back there. And you put them in one by one into the front of the scalp where you're losing it.
Taking pickles out?
It's literally one by one.
That's a great analogy. I love that. So then you implant each hair one by one.
Correct. And the trick is, because you put them one by one, you got to make sure it's at the right angle, the right direction coming in the scalp. Things normal people don't think about probably, but when you do all that right, you can't tell what was transplanted and what was yours.
How long does a normal hair transplant take?
It depends on how many hairs you're transplanting. It can take anywhere from 5 to 6, 7 hours. But you're awake. Wow. You're watching Netflix. You're talking to the staff. This is like a long haircut.
Dr. Yalamanchili, it's fascinating that so much can be done now. So we're going to have you back, and we'll talk more about maybe what our little two-finger method.
No, I love that.
Maybe next time you could do a little something,
yeah, sure.
something
if you're
for
willing to be a
this.
volunteer, let's do it.
Thank you so much. For more information on Belage or to book a consultation, you can just visit them online at belagecenter.com. And Dr. Manchili.
Got that right.
Yalamanchili.
It's like you forgot the yalla.
Jeez, it is a difficult last name, but thank you again for stopping by. Enjoyed the conversation.
And there, of course, is the website. Now, coming up next, it's a golfer's paradise. We're taking you inside the PGA Tour.